This is our sharing circle. We would like to acknowledge that we are in the traditional lands of the Tecumlips, Tessewepnik, and the Tekal within the Secwepnik Ulu, the traditional and unceded territory of the Secwepnik. The region TRU serves also extends into the territories of the Statium, and Lapamoose, Silkatine, Nualks, I can't pronounce the other two. Anyways, that's where we are, and we'll just get started for our sharing circle.
So for our sharing circle, we'd like to let everyone know that they're respected and whatever they share will be in a safe space. This is something we were given as first year nursing students from the elders. It contains sage in it, and this is what we'll use to pass around so that we know who's talking. I'll go first. So we all agreed as a group that we would talk about something that really impacted us or really changed our worldview. So that would be, for me, is privilege, or more specifically, white privilege. It's kind of like difficult to talk about it because you don't know it's there unless you've experienced it. So being a white male, haven't really experienced any privilege at all. I haven't actually. And it was a tough place to start thinking about it because how would you talk about it if it was invisible or you didn't know it was there? So I talked to my grandpa. My grandpa's an immigrant from a Caribbean country, and he's visibly black. So I asked him, have you ever experienced where other people have or experienced racism, or experienced where there wasn't a time you felt privileged? And he told me stories about people skipping job opportunities on him in the beginning, people making comments of him marrying a white woman, and just some slurs made about him. And I didn't get it until now, where I've never once experienced what he's gone through. So in that sense, that was what privilege means to me. And just that idea of how society treats some individuals superior, and then others are treated like second-class citizens. And that was really the most impactful thing to learn about.
That was so eloquently put. For me, nothing in the course specifically was surprising, as so much as it was sad. I think anytime that the topic of the whole matriarchal part of women's lives gets brought up, and how women in Indigenous communities, their status was basically, they were demoted, for lack of better words. That sucks. I mean, there's really no other way to put it. As a woman, I'm important in my family. I'm valued by my husband, by my daughter, by everybody else in my family, or at least they tell me so. So that thinking of that and having to go back and being all of a sudden not treated like I am would be awful. And then the other part that stands out, again, as a mom, is the thought of, if I were, I am Indigenous, but if I were visibly Indigenous back in the time when there was residential schools, it would be awful to just have to send your kid away. The thought of that is so sad to me. And having them being made to feel that who they are is not good enough, how they were born, with the skin color they are, the culture they were brought up in, the parents they have, to be made to feel shame. That sucks, because obviously I don't raise my daughter that way. Who she is a valued being in and of herself, and it'd be really sad if anybody tried to make her feel feel anything less than that. So that's how I'm struggling.
So there's a few things that surprised me within this course. First thing, as a Sri Lankan, I don't really, it's not that much surprising how the Indian Act was cruel, but I didn't actually expect something like that in a Western country like Canada. So I personally think the Indian Act was really cruel, and some outsiders come to the people's land and they try to conquer their land. It's just like when someone comes into your house and start to tell you how to live, don't do this, don't do that. It's not really that nice. And the other part is the residential schools, how children were taken away from their families at such a young age. Actually, I was really attached to my mother, so I really couldn't imagine how it would be like if I was taken away like that. So, and then the other part was there are a lot of variants of racism. Actually, I knew only the black and white racism which was in US, but I got to know there was a lot more varieties of racism, and sometimes I also unconsciously make assumptions when I see some people. But among all that, I am delighted to say that the government take action at least now to correct the mistakes they are making. So I was really devastated about these residential schools, because when a child is small, that's when he really needs the care of his parents, and when they were especially taken away to residential schools, they were taught to go against their culture and their own people. And so they hated their parents when they went back to the villages. They didn't know their own language. And then the other thing that devastated me most was the permit systems. So the indigenous people needed permits to sell their own stuff and to buy stuff. So that was not at all acceptable. So as I told previously, I was also unconsciously racist, making assumptions looking at people. So I believe we should make allieships with indigenous people. So we should make them feel treated equally as all others. We should listen and respect to their ideas, and we should take action when we see an indigenous person is being offended. So we need to stand up against racism. So I will believe learning about the indigenous culture, building good relationships with the indigenous people, and reflecting on our own self and identify our areas of improvement will really help to be good allies with the indigenous people.
First of all, I just wanted to start with, I'm from Lower Mainland, so there I didn't really have much exposure to indigenous culture. Or at first, when I moved here, I did not even know that there are indigenous people and their different population and the differences that they have from just the general population. So that was just really new to me, the whole concept. And I did not have any knowledge about indigenous culture at all till I moved to seminar. I did my LPN there, so we learned a bit about indigenous population and their practices and the culture. But still, I was like, okay, I don't know much about it. But then in practice, I got to see a few indigenous people in my practice in hospital. So I learned about their culture, heard stories about their culture. And another story I have is I got an opportunity to go to Lillooet last year, and they were having this COVID clinic, so for indigenous people. And I went there with one of my friends, she's a nurse too. So we did the clinic for like 3 days, and I was just amazed to see like how just the infrastructure, like how poor it was, like they didn't have enough nurses, they didn't have enough resources till like this day. Like you would think, oh, everybody should have like equal healthcare and everything. But just looking at all that just kind of made me feel sad. But I was happy that I was doing something for them. They were so respectful, they were so welcoming, they were so thankful that we were there and we were doing the vaccines. So that just another part of, that was just a good experience. Another thing I would like to talk about is just the concept of Indian Act. I didn't know much about it at all before this, so I'm glad that we are doing this course on Indigenous culture and learning all about the history and all the trauma they have gone through. So one thing is the culture, that they were not allowed to express their culture, they were not allowed to dress the way they wanted, they could not talk about their culture in the open. So just thinking about that, like if one day someone just told me, oh, you can't wear your traditional clothes or you can't speak in your own language, how would that feel? So that was just one of the things I thought that really cool, and that the trauma that they stripping off their culture, the trauma that Indigenous people felt from that.
Until now, until I got enrolled in the nursing program, I did not know about Indigenous people because I was born and brought up in India, and I did not know anything about Indigenous people until I joined the nursing program and got to know about the people and the culture here and how they were treated in the past. So I'm really grateful that I have this opportunity to learn about Indigenous people and their culture through this course. Today I'll be talking about how not being able to speak the language, the home language, being able to speak your home language is just taken away from the colonizers here. Makes you feel that you don't have anything left, because language is the only thing that you speak. It makes you feel connected with your culture, and when the language is taken away from you, there's nothing left with you. Being an immigrant, I can imagine not being able to speak your home language and have to talk in some other language, and then on top of that being punished when you're not able to speak English is a trauma for Indigenous, has been a trauma for Indigenous people. I can imagine, because my first language is not English, and I can imagine if I was to speak in English. I am fortunate enough and have a privilege to learn the language English, so that I'm sitting here and talking in English right now. But I can imagine when I was a kid, if I was a kid and I had to talk in English, which I had no idea about, would be so traumatizing for the Indian students there. I was reading the book, The 21 Things You Didn't Know About the Indian Act, and I read that when the Indian students in the residential schools did not speak English or didn't know how to speak English, they were punished. And the punishments included like washing their mouths with soap. Can you imagine how how disgusting, or I don't know how hard it would have been for those students to like wash their mouths with soap, like the inside of their mouths, just because they were speaking their home language. And then also they had to pierce their tongues with sewing needles, which was so painful and traumatic as if you're a kid in the school. And I don't know, it's hard to imagine like how being kids you were like forced to pierce your tongues with sewing needles when you can't speak English. That's just how, I don't know how cruel those people were that they did this just so that the Indigenous people get assimilated from their own culture. So I guess language is the thing that connects the people and the culture, and then when the language is gone, people just have nothing to identify with, they don't have anything to grow with, they're not able to talk. And then I also read in the book that when the kids, the Indian students, when they became parents, they taught their children English so that they won't have to go through all those punishments and trauma that they had to go in the residential schools. So generations by generation this happened, and then eventually the indigenous languages are now disappearing just because somebody in the residential school was forced and traumatized for not speaking their home language.
So I'm also from the Lower Mainland. I grew up in Maple Ridge, and there wasn't that much in the way of like indigenization efforts. There isn't really a band there, from what I know. So my exposure to like indigenous culture and such wasn't really a thing. So I wasn't aware of a lot of the, I was aware of it because it was taught in school, but I never really got to see it. I would you'd hear about it through instruction or social studies class, but you wouldn't ever get to actually see the people and see the culture and interact with it. So since coming up to Kamloops and seeing how active the band is in the community, it's quite eye-opening about what they went through and what progress needs to be made. And what's most impactful to me is just the building of that, especially from like the beginning of the nursing program with the introduction to the band and all that. That really struck a chord with me to try and look at the imbalances and the discrimination. That's all I have to say.
That's good. Thank you everyone for being so respectful and insightful. So the next question we'll ask everyone, and it might be, and it's a really important question, is how are we going to attribute what we've learned in this class into our lives or into our nursing practice for the people that are nurses here. I'll go first. We've all heard the stories of Indigenous people being treated unfairly or even inhumanely at the hands of the medical system, and we've learned that people have died because people were negligent and were racist. It's up to us as healthcare workers to deliver care that is impartial and fair and equitable. Together we can be culturally sensitive and change the way healthcare is done in this country.
A story that always kind of sticks with me when I think of healthcare pertaining to specifically Indigenous people is, I think this was a year or two ago, where it came out that there were not just like nurses but other healthcare workers, when an Indigenous person would come into a hospital, they were all making bets about what their blood alcohol level was going to be, which kind of just speaks volumes of the culture and the attitudes towards Indigenous people. Because, yeah, okay, maybe some of them were drunk, but I mean, lots of white people come in drunk too. Lots of people everywhere come in drunk, and that's just life. So to automatically, because of somebody's background, label them as they're going to be drunk, what's their blood alcohol going to be, that just like snap judgment without knowing anything about them is awful. So I think something to carry forward, not just in healthcare, but life in general. You don't know something about you don't know everything about somebody's background. You don't know how they identify, both like culturally, could be sexually, could be anything. Just like hold the judgment until you know more of the situation.
So by attending these lectures, I have learned a lot that indigenous people has gone through a lot physical and mental stress. So we can't expect them to be really happy and all the time because they really need some time to recover considering everything what has happened. So I believe it's not good to judge someone even if he's like not nice to you. Just give them some time, give them some space, so then they will actually identify and be nice to you when they feel safe around you.
In my nursing practice, I can try to make indigenous people's experiences just a positive experience for them. I know there's so much stigma, so much just racism towards them still, and these days too. So I would say just listening to them, being empathetic, trying to know trying to get to the root cause of what's going on with them instead of just being judgmental and just making assumptions about them. That can just turn their experiences at the hospital or any health facility just into a positive experience. And there are so many instances where people just don't go to healthcare system for help, or they just don't seek any medical attention because they know there's gonna be judgment, and there's so much trauma from that they just don't seek medical help, and that just ends up them not getting well and deteriorating their health further.
Just like I would not want somebody to make assumptions about me and be like, oh, she's brown, must be Indian or Asian. Rather, I would want somebody to come and ask me, ask about me and my culture. Similarly, I also don't want to make any assumptions. If I see indigenous people, or if I see anybody, I don't want to make any assumptions or judgments and guess, okay, they belong from this culture, so they might be this. Also, I've heard some stories from the hospital where the healthcare workers made bets about who's gonna treat the patients. So they put their names in the bowl, and whoever's name comes in it is gonna treat the indigenous client. So I guess learning from the past and learning from the stories that I've been listening to, I don't want to repeat them. That's what the history is about. It's like learning from the history and the mistakes that the people have made in the past. I don't want to be one of them for the coming generations to make those mistakes again, and don't want to repeat the history again.
So in my practice in life, I would like to try and be a lot more anti-racist. I've had instances where I'm not really sure why something made me uncomfortable, and later realized it was some sort of discrimination. So definitely being able to identify and realizing that, oh, no, that is something racist, and being able to intervene is definitely something I would like to do, as well as being more conscientious and performing more cultural assessment pieces to better understand someone's culture, to know how to better act and behave around that person, what makes them the most comfortable.